Our consensus statement brings together a really broad range of organisations and disciplines from around the globe. The point of this consensus statement is threefold. It's to coordinate efforts and to enhance collaborations, to improve our preparedness with a really specific focus on those vulnerable populations, and to engage public, private and voluntary sectors.
I think it's just increasingly clear that climate change and extreme heat is really going to be defining our health moving forward.
We can see that over the last few years that has escalated. We can see that in the excess heat deaths that the UK Health Security reports. And we can also see that for ourselves in terms of the type of heat waves and high temperature events that we're seeing, which are much more frequent, prolonged, and also quite high overnight temperatures.
While everyone is at risk, our vulnerability is shaped both by physiological factors such as age and our health, and exposure factors such as occupation and socioeconomic conditions.
Physiology is a really important part of the big puzzle when it comes to heat and health. We need to understand what's happening in the body in order to be able to prevent those pathways from happening. Whilst public health can play their part in understanding the population elements of risk, the physiological part provides us with that picture of what's happening at the individual level.
A heat-resilient roadmap is a really important part of a just transition, because as well as ensuring that the most vulnerable are protected as we move along this transition to net zero by 2050, it also protects workers in high exposure sectors, older people, people with pre-existing health conditions.
We're very grateful that the Physiological Society has taken the lead on highlighting the risk of heat for population health. It's really clear for heat that there's a very complex pathway to those health outcomes and those preventable deaths. So this is really a very wicked problem where we need to work very closely together.
I think it's increasingly clear that a health-centred approach to tackling climate change is going to have clear economic co-benefits. And that's whether we think about the way we move, the fuels we burn, the kind of cities we want to live in. All of these are directly linked to heat and directly linked to health.
By putting physiology at the heart of a coordinated response to rising temperatures, we can enhance heat resilience, thereby promoting healthier, more prosperous communities and more equitable places to live.
We need a heat resilience roadmap and we need to action it, and we need to do this fast.